Okay, so I think we are right at time, so we can go ahead and get started. We're so happy you were able to join us today. Just a few quick reminders before we get started. Feel free to turn your camera on or off, but as a reminder, this session will be recorded. So it's up to you if you'd like to share your camera or not. Please keep your microphone on mute throughout the presentation. And if you do have questions, feel free to share them in the chat as we walk through the presentation. And we may or may not have time at the end for a Q&A session. If we do, we'll answer your questions. If not, we'll send out written responses and be sure to follow up on any questions that you have. So today, we're here to present the results of the point-in-time count for 2021. We'll also be sharing some other data points to give you kind of a broader context on the state of homelessness in San Antonio and Bexar County. I'll be presenting. My name's Katie Vella. I'm the Executive Director at SARA, and I'm joined today by Eric Samuels, the President and CEO of the Texas Homeless Network. And that's going to be really helpful so that we can see San Antonio's results in the broader context of what's happening throughout Texas with homelessness. So I want to start by telling you a little bit about who SARA is. So we're the South Alamo Regional Alliance for the Homeless, and we're the Continuum of Care lead agency for San Antonio and Bexar County. And so we really act as a coordinating body around homeless response in San Antonio. And we're also responsible for submitting reports to HUD on the state of homelessness in San Antonio and Bexar County. So that's one of our core duties, is to track and report on that data and look at trends over time. Our mission is to ensure that everyone has a place to call home in San Antonio and Bexar County. But again, we play that role of the coordinating agency. So we listen to people with lived experience and use that to drive policy decisions. We work towards strengthening our coordinated system of care across all of San Antonio. We work on sustainable strategies through partnerships and building alliances with new partners. And we focus on measurable impact. And that's really what we're here to talk about today, is to look at our data as one aspect of seeing that impact that's happening over time. So what is the point-in-time count? So some of you may be familiar with this event. For some of you, it might be new. But it's basically an annual census of how many people are experiencing homelessness in San Antonio and Bexar County. We always conduct the count on a single night in January. So it's a one-night snapshot of what's happening throughout the community. Typically, we do both a sheltered count. We count everybody who's currently staying in shelter that night. And we also deploy volunteers throughout the community to conduct an unsheltered count. This year was unique, and we made a community decision not to do our unsheltered point-in-time count due to COVID-19. And at that time, there wasn't widespread vaccination when we were looking to do the count. We made the community decision not to conduct the count out of fear of the risk we'd be exposing people experiencing homelessness and our volunteers. So we'll go over the results of the sheltered count and compare that to previous years, but we'll also share some data points looking at unsheltered data throughout the last year. So we do collect data on unsheltered homelessness in our local database, the Homeless Management Information System. And so we have a modified report this year, but we can still share some results and demographics and findings. But just please make a note that when we share unsheltered data, this is not comparable to previous unsheltered counts. This is different just for this year. And we hope to be back to our normal process again next year. So let's start with kind of looking at overall trends for the point-in-time count. And we're sharing results today and some key findings, but we also have a full-length report that we'll be releasing at the end of this week. And what you'll see in the report is when you look at our graphs, we have our sheltered trends over time, and then our unsheltered trends we don't include, just so that you can see that this is a unique count this year and it's not comparable to previous years, but you will see a lot of data throughout the report on street outreach and the work that's happened throughout the year. So overall, you can see, looking at the last 10 years of data in San Antonio, We've done a great job of keeping homelessness either flat or slightly decreasing over time. And when you look at the population increases that have happened in San Antonio, this really is a testament to all of the hard work that's happening, that we're not seeing major spikes in homelessness, both sheltered and unsheltered. Looking at the results in particular for this year, you'll see that there was actually a significant decrease in the number of people that were staying in shelter. So now to start to look at our key findings for this year, 1,499 people were in shelter the night of the point in time count in January, and this was a 10% decrease from the 2020 sheltered count. Now, anecdotally, we heard throughout the year that we were seeing fewer people come into shelter. At first, this was due to social distancing concerns with a congregate setting. Later, it could be due to the moratorium on evictions. Fewer people were actually getting evicted over the last year. So we're seeing that people may be behind on their rent, but haven't yet reached the point of entering shelter. I will say we continue to share in all of our marketing and meetings that our shelters have done an incredible job of implementing safety measures, CDC guidelines, and our shelters are an incredibly safe place to access services. So we hope as we continue to share that message, people will access shelter if they need it. So 1,251 people counted were staying in an emergency shelter. This includes Haven for Hope, the Salvation Army, and other more short-term shelter stay programs. And 242 or 16% were staying in transitional housing. This is still temporary housing, but it's up to 2 years. And so they're also included in our sheltered count. And as we share data on street outreach and unsheltered homelessness over the last year, we're looking at 2,013 people between the last point in time count and this one when we look at that full year. So now looking at our age demographics in shelter, 74% of individuals in shelters are adults over the age of 24. 86 individuals, or 6%, are young adults between the ages of 18 to 24. And 9 people that were counted were parenting youth, and 3 were unaccompanied youth under the age of 18. And so you'll see that the vast majority in our shelters are adults over the age of 24, but we also know that it can be more challenging to engage with young adults and youth and get them access to services. So we're very excited about the upcoming youth drop-in center that'll launch to create another safe place that young adults can access shelter services and get connected. Now looking at gender in shelters, 60% of individuals are males, 39% are females, and 1% are 15 people identified as transgender or gender nonconforming. Sexual orientation is a very important data point to us. It's not currently part of the annual point in time count report that we submit to HUD, but we do reference some other data and materials on LGBTQ and its prevalence in homelessness. And we recommend this State of Our Community report as another place to learn about this issue. But LGBTQ young people are 120% more likely to experience homelessness than non-LGBTQ youth. So you can see when we're talking about homelessness, and in particular youth and young adult homelessness, this is a critical factor for us to be looking at. And up to 40% of a homeless youth population identifies as LGBTQ, compared to 7% of the general youth population. And the data source for this is True Colors United, and you'll see in our full-length report that we reference some of this other work that's happened in San Antonio that's very helpful to paint a picture of this issue. And this is an area where we're continuing to learn and collect data through our Youth Homeless Demonstration Program initiative. Now looking at ethnicity and race, 50% of people counted in shelter identified as Hispanic or Latino, and 50% identified as non-Hispanic or non-Latino. So we had a 50-50 result this year. So you can see compared to the general population in San Antonio that non-Hispanic, non-Latino are actually slightly overrepresented in our shelter population. And 75% of people in shelter are white, while almost a quarter, or 23%, are Black or African American. And we saw a similar ratio when we looked at our unsheltered data over the last year, that 74% were white and 22% were Black or African American. So again, we're seeing a disparity here where when you look at our general census population for San Antonio, Black or African Americans are overrepresented in our shelter and in our unsheltered homelessness numbers. And this is an area where we continue to have discussions as a community around equity and how we build better tools to resolve this issue. Now, chronic homelessness, this is a HUD term that we use for our report to HUD, but its basic definition is people who have been homeless for at least a year or have experienced homelessness repeatedly and also have a disabling condition. And so the results this year were that 229 people were chronically homeless and staying in shelter. This is actually a higher number than we saw in shelter last year. Last year, it was 138 people. Now, we didn't collect the data in our unsheltered point in time count to see what the numbers were for people who were unsheltered, but this could be an encouraging sign that our shelters and our partners are doing a great job of engaging with people who have been homeless for a long amount of time in the long term and getting them moved into shelter to access services. So we want to continue to see this trend that we're doing a better job of engaging with people who have experienced long-term homelessness. This can also be a really important number when you're trying to estimate the permanent supportive housing resources that we need as a community for this population. And so if you look at the referrals that we make throughout the year, permanent supportive housing is such a precious resource. We only refer about 5 to 7 people per month, but we have 229 people at a minimum that need that intervention. So this is an area where we can continue to do some advocacy and look at getting that resource and intervention expanded. Now, veterans is an area where we've done a lot of work as a community, starting with the Mayor's Challenge to End Veteran Homelessness in 2016. We did a big push and initiative to move as many veterans as possible into housing. And since then, we've continued every quarter to monitor how we're doing and making sure that we have housing capacity for every veteran that experiences homelessness in San Antonio. And so it's very encouraging to see a continued positive trend here. We counted 123 veterans, or 8% of our shelter count, and this was a 23% decrease from last year's sheltered count. So we're continuing to make progress. We have a very active veteran work group and veteran resources that are well coordinated. And so they've continued to do a great job and really shown how you can work with one specific population and those resources coordinate and make a huge impact. And it's been a model for how we can approach homelessness in other areas. And then looking at our data over the last year, 4% of people who were engaged in street outreach were veterans. Next, looking at families with children, looking at our shelter count, we saw a 42% decrease in families in shelter. This is consistent with what we were hearing anecdotally and seeing in the data throughout the year, that fewer families with children were accessing shelter. So again, it's critical that we continue to get the message out that shelter is a very safe place to access services. And we've also been doing a lot of preparation to make sure we're ready for the end of the moratorium on evictions and that we're well coordinated to try to prevent homelessness for as many families as possible. We're hearing that families are behind on their rent, and we're preparing for that potential upcoming snowball of evictions or people who need help suddenly all at once. And so we've worked closely with our ESG and prevention partners, the city, the county, to make sure we have a coordinated response and we're ready to help get people the help that they need. Now, looking at domestic violence, we did see a decrease in domestic violence when looking at our shelters compared to last year, a 6% decrease. However, we think this also might be tied to the decrease we saw in families seeking shelter. It may be that people are not yet at the point of eviction or didn't feel comfortable accessing shelter. And so it's important that we don't look at this year in isolation, but continue to monitor trends over time, because other reports over the last year have cited an increase in domestic violence concerns. And so we think that we just haven't seen it due to those issues with people accessing shelter over the last year. So now just specifically painting kind of a picture of what we saw with unsheltered homelessness over the last year. So we did not conduct our annual unsheltered point in time count, but we did look at 2,013 individuals who accessed resources through street outreach over the last year. And what we found was that 62% were male, 37% were female, 1% were transgender, 7% were young adults. So these are young adults who are on our street, living in places not meant for human habitation. Definitely need to make sure they're a vulnerable population, that we're getting them connected to resources. 15 people were two-person households. 19% reported a history of domestic violence or actively fleeing domestic violence. 22% were Black or African American. And I want to definitely draw attention to this final infographic that 71% reported a mental health concern. And so you can see this correlation between people who have been unsheltered for an extended period of time that have mental health issues. And so this is an important data point for us to continue to look at how we engage. Are we making access to services as easy and clear as possible? And so I think this is definitely an action item for us as a community over the next year, is to figure out solutions for people who are unsheltered and also have a mental health concern. Now, in addition to our point in time count key findings, which we've shared, and again, there will be a full length report available at the end of this week that you can use to analyze, use for grant writing, just for learning. It'll be a very helpful tool for us to use over this next year. We also wanted to share an additional HUD report that we monitor called System Performance Measures. And so these are really 7 critical measures to look at our progress, and it looks at an entire year of data and all of the agencies that enter information into our homeless management information system. And so these 7 areas are, the first is length of time homeless. So how long does someone experience homelessness in our community? We also look at returns to homelessness. So we get people connected to permanent housing. How many people actually stay in permanent housing at 6 months, a year, 2 years? We want to reduce that recidivism rate and for the permanent housing solution to stick. We also look at our progress in eliminating homelessness. So how many people each year are actually homeless across our whole system? We also look at job and income growth. We want to see both non-employment and employment income increasing, because we know that's critical to keep people in housing. We also look at how many people are becoming homeless for the first time. And this is again about that upstream intervention. You know, before someone is even evicted, how do we intervene and prevent that homelessness from occurring in the first place? Measure 6, this is one that isn't currently used, but is going to be used in the future for decision making. It's basically looking at people that fall under other definitions of homelessness, such as being doubled up in crowded housing or couch surfing. And so that's an important measure for our youth and young adult work that we'll continue to work towards capturing that data. And then the final is successful placement and retention of housing. So this is actually moving people from the street into permanent housing and looking at that percentage increase. So our findings for this fiscal year, and again, we know this was a different year and there were other factors happening that impacted the results, but we did see an increase in the length of time that people experience homelessness overall. So the average number of days is 127 days. And the median is 67. So we can estimate that between 60 to 120 days is the average amount of time someone experiences homelessness. This is also a lagging indicator. So for example, if someone's been on the street for 5 years and we finally engage and help them move into housing, that would affect our average at the point that we get them housed. So it's a lagging indicator, but still something important that we want to look at. We want to reduce that trauma and that time somebody experiences homelessness as much as possible. Our returns to homelessness decreased. So typically our return rate is about 25%, and that decreased to 24%. But we also know that we have to factor in the moratorium on evictions, and that may have helped prevent some people from returning to homelessness. Our number of people experiencing homelessness overall did increase when looking across our system. This is used based on our comparing point in time counts. And so looking at last year and the previous year, our unsheltered numbers slightly increased. Looking at some of the additional measures, job and income growth, we saw some measures went up and some went down. They've stayed fairly consistent, but we know with the impact of COVID-19 on jobs and employment, the whole sector, this is an area we'll have to keep a close eye on and make sure we're connecting people to employment opportunities as we can throughout this next year. The number of people becoming homeless for the first time over this time period actually decreased. Again, this could be because some people are staying housed, they haven't been evicted, so we'll continue to look at this trend over time. And then the last measure we wanted to share is successful placement and retention of housing. We did see that this increased. We're referring more people directly from the street into permanent housing, kind of that housing first approach. And so we saw a lot of success there. The other intervention mentioned is permanent supportive housing. So this is long-term housing with case management. 96% of people in permanent supportive housing maintained and retained that housing at the end of the year. So we can see that this is a really successful intervention, and one that we hope to expand to help resolve some of the chronic homelessness, mental health, and substance use, things we're seeing with our unsheltered population. And so next, I'd like to hand it over to Eric to help the broader context of what's happening throughout Texas.
All right, thank you, Katie. And before I start, I should probably just give a little overview about Texas Homeless Network. So our agency works statewide on what we call our statewide initiatives focus area. And through that focus area, we work with all 11 homeless crisis response systems. San Antonio, Sarah, that's one of those systems. And as part of that work, we perform a lot of duties. One of the things we do is we collect data and we aggregate it on the statewide level. The other focus area we have is we are the lead agency for what's called the Texas Balance of State Continuum of Care. So our staff work with agencies in 215 counties that are primarily in our mid-size or rural areas of Texas. We work with all of the counties that surround San Antonio and Bexar County. So that's the other focus area. And that's where the majority of our 30-person staff, they work on that side. And the statewide initiatives has 3 staff members, of which I'm one. So every year through our statewide initiatives focus, we gather data from all 11 homeless response systems or COCs, that data that they submit to HUD. And then we aggregate that. Now, I think what's important to keep in mind when we look at this data is that this data is collected on one day for most of our communities. There's one at least that collects over 3 days, but it's essentially a point in time count across the state. So it's a one-time snapshot. So that in and of itself right there limits, our ability to really see what's going on in the state. That being said, it's the best source of data we have for looking at homelessness on a statewide level right now. We're working on other ways to gather that data on a more frequent basis in the future. And then I have one other caveat. This data is from 2020. So this data is going to not be completely comparable to 2021. So keep that in mind as we go through everything. So this infographic gives you a snapshot of homelessness in Texas on any given night. And so what you can see right off the bat is there's a little over 27,000 people experiencing homelessness on that one-time point in time level. That is a number that has been in line with numbers over the past 4 years or 5 years total, where we see that number has gone up. So it's slightly gone up every year for the past 5 years. That's an unfortunate trend that we want to see reversed. Despite that, just like San Antonio has done an excellent job of housing veterans and getting veterans off the street. So is the entire state of Texas. We're also seeing a decrease in households with children, and that's good. And since we're looking at 2020 data, we may not be worried about some of the reasons for that being the same as what Katie mentioned earlier. But I will say we have seen with households with children a disturbing trend over the last few years where the number of households with children or families unsheltered has increased. So we're hoping to see that that's reversed in 2022, which is when we should have our next full-time point in time count. The ratio of homeless individuals, folks that are households without children compared to families and unaccompanied youth is very similar to San Antonio's as well. And then finally, the barriers that people face to escape homelessness, that has been pretty consistent, really, honestly, over 20 years. And I've been doing these counts for 20 years, well, 20 plus years now at this point. So you can go to the next slide. Unless I can. Okay, there we go. So as I mentioned earlier, that 27,229 number, that represents a trend of homelessness going up over the past 5 years. So you can see this line here at the top, this is total people experiencing homelessness. So you see an upward trend. What you don't see is that if we had 10 years of data on here, you would see that number going down to that 23,122. But unfortunately, we have seen the number going up over the past 5 years. And I think that's what's important. We need to focus on that and then focus on reversing that trend. And if you look at what has contributed the most to that, you can look toward individuals or households without children. So you can see that's that red line. And as that red line has increased, so has that black line. So that is where we are seeing our increase in homelessness. Folks that are in households with children, the unaccompanied youth, and the chronically homeless, you see a pretty much consistent trend of leveling out of people experiencing homelessness or even a slight decrease. So we are looking at singles or households without children that are the reason for this increase. So we need to get those folks off the street. Of course, we need to get everyone off the street, but that is where we could make a real measurable impact. So I have one more slide that I want to show you. So you can go to the next one. So this is looking at homelessness in Texas in terms of rates. So what this shows is it's the number of people for every 10,000 people in a community that experience homelessness on a point in time basis. So before we go into all of this, I want to make sure that you understand that what we're looking at is largely dependent on what the denominator is. So for Amarillo, we're looking at a number that we divide by just the city of Amarillo. So their denominator is smaller than some of our other communities. And that's a big contributor as to why they have the largest rate of homelessness. Now, that being said, we're looking at the geographic area that continuums of care or homeless response systems cover. And if we're just looking at the data like that, Amarillo does have the highest rate of homelessness. So I purposely did not put these in a rank order because I don't really like comparing COCs against one another. We all, across the state, everyone has their own challenges, and I don't know that it's useful to compare and contrast one community to another, especially if they are hundreds of miles away from each other and they have totally different population makeups. But you can see where San Antonio is, lower than some communities, higher than others. I will say that when looking at this, I would not get alarmed, because I would say that look at the denominator that San Antonio has as opposed to other places. Other COCs like Houston and Dallas and Tarrant County, they cover multiple counties. So they have a higher population as their denominator. So that would automatically lower that rate of homelessness per 10,000. So keep that in mind when you're looking at this. And I think that will give you a little bit better context. Still, I think it's good to, see where you are and compare yourself against your own stats from year to year in terms of rate of homelessness. I did see that a question came in, so let's see if I can answer that. Okay, so this question is asking, the Rio Grande Valley and Coastal Bend are not represented in here, and how do those compare? So the reason they're not is because in the Texas balance of state, this line here, although I'm not sure if you're seeing my cursor, but the light blue line, that covers those areas plus 215 other counties. So if we wanted to pull out those areas, we could pull those out as their own. They're considered local homeless coalitions and not continuums of care. So they don't submit data to HUD by themselves the way San Antonio or Dallas or El Paso does. And that's why they're not on this chart. I could go back and look to see what kind of the rates of homelessness are in some of those communities compared to San Antonio, and see how that would be helpful. I know that in some of our communities, Corpus Christi, they have a fairly high rate of homelessness. Rio Grande Valley tends not to have a high rate of homelessness, or they haven't in the past. And that's, I'm just going anecdotally, but that's what I would expect to see. So I think we're gonna get a better idea in 2022 about the effect that the pandemic has had on the state of Texas in regard to homelessness. Right now, it's really hard to compare where we are as compared to 2020. And that's unfortunate. We want to be collecting data more often so we can get a better idea. And that's something we're working on with our Texas Homeless Data Sharing Network project, which San Antonio's in the part of our planning group for. So we appreciate their participation, and we hope that will help us get a better grasp of homelessness in the state at any given time. And I probably went over my time, so I want to hand it back.
No, not at all. And thank you so much. And I'm glad you were able to explain the balance of state versus the local continuum of care. I think that's an important thing for our community to understand. And so Texas Homeless Network has been a great partner in kind of connecting the dots across all of the communities in Texas, leading kind of the advocacy agenda around statewide solutions. And so we're super grateful for that and thankful for your time, Eric. And so I think we're just going to talk briefly about our upcoming sessions, and then we might have a few minutes if there are additional questions in the chat we can check. I see that there are some, but I can't read what they say yet. So today's presentation was focused on point in time count data, some of the unsheltered trends we saw over the last year, and the statewide point in time count data. But we know that in understanding homelessness, the numbers and the data, that's just a piece of it. And so we do have 2 more lunch and learns coming up this week. On Wednesday, we have our next session, and we have Diane Yentl, the CEO of the National Low Income Housing Coalition, presenting alongside some local experts. So Leela Powell, the CEO of LISC and president of the SARA board, will be moderating a session with Molly Biglari from Haven for Hope, Nikisha Baker with SAM Ministries, and Valerie Salas with Christian Assistance Ministries to talk about the gaps in San Antonio and get that important context and experience that all of these experts have. And so that should be a great conversation. And then on Friday, we'll focus on what's next. We've looked at the data, we've talked about the gaps. The city will be presenting alongside our Youth Action Board to talk about the plans we have around addressing homelessness, both for the broader community and for youth and young adults. And so that session will be on Friday, and you can register for both of those sessions on our Facebook page. So we hope you'll be able to attend those upcoming sessions. And then I also wanted to take a moment just to say thank you. I think all of you participating just shows your commitment to addressing this issue, and that's what it's going to take. It's going to take collaboration, discussion, alignment, understanding the issue as a community if we're going to make meaningful and positive change that's sustainable over time where we can really see the impact. So this is a great step, is all of you that participated today. And we will release our full point in time count report this Friday, May 14th. It's a really extensive and helpful report that includes research and literature from other sources. And so looking forward to sharing that with the community. You can subscribe to our newsletter to receive a copy or check our website on Friday.